Welcome to section 2 of immunology. In this section, we'll be discussing acute inflammation. Acute inflammation is the immediate and transient response to tissue injury, pathogens, or necrosis, and it's mediated by the innate immune system. And the inflamed tissue itself will reveal neutrophil infiltration and tissue swelling. So let's briefly talk about the general function of neutrophils. Neutrophils will rapidly invade the connective tissue in order to phagocytose the pathogens or the necrotic debris. And it's important to recognize that phagocytosis will deplete the neutrophil glycogen, and this causes the neutrophil to die through apoptosis, and this forms pus. So here's something you should really lock away in your head. Any evidence of neutrophil infiltration or pus should make you think acute inflammation. Now, this is true even if the inflammation has been going on for several months. In other words, if something's been going on for 8 weeks, but there's neutrophil infiltration and visible pus, then you think, this isn't chronic inflammation, this is acute inflammation still. This is the overview figure of acute inflammation which takes place in a tissue. There's an insult, or tissue trauma, which then initiates inflammation. Now, this process is very intuitive, as you will see when we move along. So even though it may seem overwhelming now, it will all be very clear to you. Right now, focus your attention on one thing, this neutrophil infiltration, or neutrophil chemotaxis you see here. You can see that there are many arrows pointing toward neutrophil chemotaxis, indicating that acute inflammation largely functions to bring these neutrophils into the tissue. And as mentioned before, the job of these neutrophils is to gobble up all the pathogens or the necrotic tissue. And neutrophils are discussed in more detail in section 3 of this chapter, which is the next video. Next, notice the swelling. All of this inflammation will increase the permeability of the post-capillary venules. So if we stripped away everything else from this image, you can at least remember that when you look at the tissues, you'll see swelling and neutrophil infiltration. This is a histologic image from a tissue during acute inflammation, and you can see increased fluid spaces, or you could call this edema. And also the neutrophils have left the blood vessel and entered the tissue. So we've established that inflamed tissues will reveal neutrophils and swelling. But there's clearly many things taking place during acute inflammation, as you can see on this image. So let me give you a brief yet solid timeline you can keep in your mind as we move forward. So think about it as what occurs immediately following the insult, then what happens 24 hours later, and then what happens 2 to 3 days later. One of the first things that happens immediately is mast cell degranulation. Also, phospholipase A2 will be stimulated, and this is what leads to prostaglandins and leukotrienes. Also, there will be complement activation. Then, 24 hours later, there will be neutrophil infiltration. And finally, 2 to 3 days later, there will be macrophage infiltration. Then, dendritic cells will travel to the lymph nodes. Okay, so there's tissue trauma, and immediately we get